A toothache can definitely leave you in agony, even in search of relief. But an antibiotic, commonly prescribed by dentists and oral surgeons, carries a serious, sometimes fatal risk.
10 Investigates' Jennifer Titus introduces you to a woman in Parrish who says she was unaware of the potential consequences and is still trying to recover.
So these are the medications that I was given.
Mary TLV never imagined she'd spend her retirement years.
They're for nausea, for stomach cramp or intestinal cramping.
Locked up in her house, taking medications and fighting a debilitating disease.
You're supposed to be enjoying these years. And it's all because of
a tooth and a pill. Yeah.
Mary says last February, a sore tooth eventually led to surgery.
But he couldn't take me for months. So he gave me clindamycin. Didn't tell me why, but told me, don't take it unless you have to.
The pain was unbearable, so she started taking the prescription.
I would say it was 10 days.
She finally got the surgery she needed performed by a different endodontist. That dental specialist prescribed her the same antibiotic, clindamycin.
Didn't think anything about taking an antibiotic because I trust that dentist or doctor knows what they're doing.
But that antibiotic comes with a black box warning, the most serious level of caution that the Food and Drug Administration issues, alerting doctors and patients to a dangerous and potentially deadly side effect.
See, I did not know that.
Is that something you would have wanted to know before you?
Yep, absolutely.
Especially because of what Mary describes happened in the weeks and months after.
Chills, like shivering chills, couldn't get warm. Took my temperature, 103. Horrible belly cramps, terrible cramps, like all on the bottom and up.
It would take 2 visits to 2 different doctors when the second one told her she had Clostridioides difficile.
C. diff was detected.
Also known as C. diff.
It's debilitating. It's embarrassing. You know, people ask you how you are, and you're constantly telling them, oh, yeah, I'm good, I'm fine. But you're not. You know, your friends start to disappear, and you're in the house all the time.
The Centers for Disease Control and Prevention estimates roughly 250,000 people contract C. diff every year, and about 15,000 of them die. So how is C. diff tied to Mary's antibiotic? Clindamycin was long considered the go-to option for patients who are allergic to penicillin, but research has shown the powerful drug can disrupt a healthy gut, creating conditions that allow a dangerous bacteria to take hold, C. diff. Hence why the antibiotic has that black box warning.
It's a nightmare.
Our investigation has uncovered that Florida is number 2 in the country for clindamycin prescriptions when it comes to Medicare Part D claims.
That just gave me chills.
Digging even deeper in the data, dentists and oral surgeons made up more than half of those doctors who prescribed it.
On occasion, I do prescribe clindamycin.
Dr. Dan Gesick is the president-elect of the Florida Dental Association and has been an oral surgeon for more than 30 years. He says he learned about the side effects of clindamycin in dental school, including C. diff.
Remember that any antibiotic can cause it. There are some that are more common to cause it, but any antibiotic can cause that problem.
And while Dr. Gesick is right, this study published in the American Journal of Managed Care tested 27 different antibiotics in more than 150,000 patients with C. diff and found the greatest risk for C. diff was observed with use of clindamycin.
I mentioned to the patients that, you know, if you start having a lot of GI upset or any kind of diarrhea or anything, please stop and give us a call right away.
That's something Mary says neither dentist specialist told her. She says she even had a medical history that should have been a red flag.
I found out that if you're over 60 and if you're taking a proton pump inhibitor for reflux, you cannot take clindamycin.
She even sent her second dentist an email letting him know the struggle she's faced since taking the antibiotic, writing, "This is to make you aware of the dangers. The consequences are life-changing." Dr. Gesick says patients need to be their own advocate.
I feel for the patient, and I would urge patients to be very proactive. Talk to their dentist. Are there any problems with this medication? Why am I on it? Why am I taking this drug? Do I need this drug? Is there anything else I can take? But ask other side effects. So, you know, again, for the patients that are out there, they've got to also take their health into their own hands. That's very important.
Now, Mary is still battling her C. diff infection. She just went to New York for a single-dose treatment. that aims to restore the gut and prevent future infections. It lists for more than $9,000 on drugs.com. Jennifer Titus, 10 Investigates.